cancer is rare, but when it happens, parents have a lot of questions. And that is what we want to answer today. The many questions that we have, we will try to cover as many as possible. We have Dr. Karemi with us, who's going to empower us on matters childhood cancer. You know, it's one of the statistics that are so grim that out of the deaths that occur in children, you know, children aged 0 to 19, a lot of them are due to childhood cancer. Dr. Karemi, karibu to today's show.
Thank you very much.
You know, for the parents who are watching, this is going to be insightful because cancer has become an epidemic in this country. It's an epidemic in the world.
Yes.
What do we need to know about childhood cancer? What is childhood cancer?
So cancer in general just means that it's an overgrowth of a cell that would be in the body, but it has now lost track. It's actually just growing on and on and on and not really doing any part. So childhood cancer are very many. We have some that will come from blood and others that will come from many other of the organs in the body.
Okay.
Yeah.
You know, I'm wondering if we have statistics for here in the country because, you know, WHO, I'm sure World Health Organization does a general, you know, survey around the world.
Yeah.
So for children aged 0 to 19, 300,000 cases per what? Per year, per month?
Actually, new cases per year.
Wow.
That is worldwide. But when we look, 80% of those children with cancer are actually found in low and medium income countries.
A lot of them in Africa.
Yes, and we have some cancer registries, and we have one global body that actually tries to estimate in each country how many new cancer cases do they get.
Okay.
And they actually, it's called the Globocan. And in 2018, they were telling us that in Kenya we get about 3,200 new cancer cases in children.
3,200.
But they added a disclaimer that they actually feel this is a very huge...
Underreported.
Yes,
There's some that go underreported. Yeah.
That a lot of the children we are treating, we are not reporting, and a lot of children are also misdiagnosed. And that's why we had the International Childhood Cancer Day, which was on February 15th.
Wow.
And this basically was really to create awareness about childhood cancer, because most people think that childhood cancer doesn't exist, but it does. And it's one of those children, of the cancers that we actually are encouraging parents, caregivers, and healthcare providers also to have a high index of suspicion, because if you don't think about it, as you rightly said, is that it's a rare disease. You might not pick it, and then we lose our children.
Okay.
Yes.
Dr. Karemi, if you can just take us through, the different forms of cancer in children, which ones come to mind?
All right, so I'll start with the commoner ones, because these are the ones we really want most people to be able to be aware about. And these, I take them in 5, and we have the leukemias. In general, we have what we call the acute lymphoblastic leukemia. It's a cancer of the immune tissue, of the white cells in the blood. And basically, it's the commonest world over. Even in Kenya, it's actually very fairly, even in my practice, a lot of my patients are actually acute lymphoblastic leukemia. Then we have the acute myeloid one.
Acute
lymphoblastic. I know.
Acute lymphoblastic. And then I'm wondering, you know, you just said that we have, you've said leukemias.
Leukemias.
So you mean there's not only one leukemia, there are different forms of leukemia?
Yes, there are
I didn't know that, by the way.
Yes, there are very many types of leukemia, basically 4 big types, but the commonest ones are actually acute lymphoblastic leukemia and acute myeloid. We still tend to get another one we call chronic myeloid, but it's also quite rare. Then we have the lymphomas. And the lymphomas are the ones we said will present with a lump or a swelling somewhere. They're still cancers of the immune tissue. And you can have a mass in the lung, in the neck. You can have it in the tummy. You can have it in the jaw, in the eyes, sometimes even in the breast. Then we
in small children.
In small children. And we also do have brain tumors. And unfortunately, brain tumors will be missed out by many people, because a lot of the symptoms, they come with headaches and vomiting, which are really not pointing anywhere to the brain. But brain tumors also do happen, or a child developing a new squint. And that tells you, oops, there's something going on there. Or, you know, the clumsiness of the children as they're walking. If you notice, they're getting very clumsy. That might be the only telltale sign there's something growing in the brain.
Interesting.
Then we have the retinoblastoma, which is the eye cancer. And we are one of the countries that are really very good at reporting retinoblastoma.
Is it?
Yes, and what you see for a parent is just a white reflex in the eye, and that might be noticed when you either take a photo of your baby or if you just shine a torch and you pick it out. And then the kidney tumors, we call them Wilms tumor, also fairly common in our region. And last but not least, either the group of soft tissue and bone tumor or cancers of the bones and the soft tissues, and we call them sarcomas. We also quite have a huge chunk of that.
You know, Dr. Karimi, the more you speak, the more it sounds so morbid.
Yes.
That all these cancers can happen in a child.
Yes.
It is actually very shocking.
It's very shocking. We do have these cases here. We diagnose them every day. But what is also very important to put out is because when people hear cancer, the word cancer brings a lot of bad memories.
Like it's a death sentence.
It's a death sentence. But a lot of childhood cancer is curable. But for you to cure it, you must have early detection and early diagnosis. And that's why we're emphasizing on raising awareness about childhood cancer. Because if people don't recognize this symptom has either persisted for too long or there are too many things that are not adding up to any disease that we commonly will see, let me have this child checked out for cancer, we'll not pick it up. And we lose our children in that way. Or they present so late that even when we can offer treatment, it's already so late, the disease is so advanced that we are not likely to cure them.
You know, Dr. Karim, just unpack it for our parents who are watching. Let's start with, say, leukemia. What are the signs and symptoms?
That's a very good thing, because if you look at leukemia, the symptoms you'll hear me describe shortly are very common, and unfortunately it's also very common in the school-going age, where you find children who are coming with fever on and off, and fever.
Also, it manifests the same in leukemia, like your typical, flu or
fever. They tend to have fever, then they might have a little bit of nose bleeding.
And you're thinking it's a normal nosebleed.
Exactly. And sometimes some children will come in and they will tell you, Mommy, I have a pain in my leg. And you think, oh, maybe it's because they fell, or maybe something else going on, or it's growing pains, or they have joint pains, or they have tummy swelling. And today I had unfortunate bit of telling a parent that in the last 3 weeks she's noticed her daughter has actually had, looking very pale, weak, lack of energy, has had fever, and she's been to hospital about 2 times, given antibiotics, not getting well. And 2 days ago, she noticed the tummy swelling, and she knows her daughter is not feeding very well. And what happened? When we took a blood count, we noticed the white cells were very high, and I had the unfortunate bit to tell her that this is leukemia.
I'm so
and she
sorry.
couldn't believe it.
I'm so sorry.
She couldn't believe it because
and
nothing
this
was
child
really
was previously normal. Everything was fine.
Very well. Nothing else. And on the day of presentation, I had a bit of nose bleeding. So it really tells you that if these symptoms persist, because you notice they have been progressing over the last 3 weeks. Every time she takes the antibiotics, things are not getting better, they're getting worse.
And you're thinking as a parent, it's just a simple bacterial infection.
Or they're school going, maybe they pick something else.
They caught something in school.
Yes. So it really requires a very high index of suspicion.
Okay.
Yes.
How about bone cancer in children? How do you pick it out?
So bone cancer is very interesting because it tends to present a lot more. There are 2 big groups, but it tends to present more in the adolescent age group, and it's more on the long bones. The long bones are the ones like, for example, in the legs, in the shoulder. So most of them will start off with pain. And when we say any pain that wakes a child up in the night is significant. You need to have it checked out.
That's a good point.
Yes.
That's a good point.
And sometimes you'll just hear the baby was playing, tripped on the floor, and they bring the child with a fracture. And when you look at them where the baby fell, it's not significant to cause a fracture.
It doesn't make sense.
So most of the time there's something wrong with that bone. Yes.
Dr. Karim, speaking of which, causes of childhood cancers.
Yes.
What significant part does genetics play?
A huge lot.
A huge one.
Yes. And I take it in 2 fronts because a lot of the patients will come in and they'll say, what did I do wrong?
Exactly.
And because why does my 2-month-old have retinoblastoma? And one thing is to recognize that childhood cancer is not related to lifestyle.
And it's not your fault.
And it's not your fault. And there is nothing. We don't know of many risk factors that cause childhood cancer. We don't know anything that predisposes a child to get cancer. And that should be a huge relief to most parents, because
That's
they say,
consoling.
Did I not feed my child right?
What did I not do right? Is it where I lived?
Yes. And a lot of that, we really can't blame it on the parents. But there are few cancers in children we know are associated with our genetics, and that means that they are inherited. And one of that is retinoblastoma.
Okay.
Because we have,
so that's inherited.
yes, it can be inherited. So we have two big forms. One is inherited, the other one is not.
Okay.
That it's a new mutation in the child. So they tend to present much later as older children. Maybe like about 2-3 years of age, up to 5. But the ones which are inherited, you notice they tend to occur much earlier. So you find a baby who presents with retinoblastoma at 1 month of age. That more points that there's something that is actually inherited from the parents.
And you've seen that before?
Yes.
1 month, that is
I was sharing with a friend that I have one of my parents who, as a child, she was treated for retinoblastoma. But that was done a long time, like when she was almost 20 years back. So she knows she has a fake eye or a prosthesis, but she thought maybe I had some trauma. Until she got married. And at 6 weeks, she showering her baby, and she looks through the eye and says, I see something wrong. And when she went for the 6 weeks vaccinations, she told the nurse, please have a look. And she diagnosed her baby with retinoblastoma. Unfortunately, when they went to check the other eye, it also had cancer. So the eye that she saw, the right reflex, had to be removed, and the other left eye was left, and it's probably going through chemotherapy to see if we can salvage and keep that eye at least and retain some vision.
That is very sad.
But if you look at it, mother had cancer, baby now has cancer, and cancer is presented very early. That is the hereditary form of the disease.
Okay. So environmental not really a factor that comes into play?
Not for now. We have a few intuitions which tell us maybe our exposures to everyday issues as parents might be predisposing us to that, but nobody can really scientifically say that
this is what is.
Yes. So we really don't know. But as we keep getting better, I think we will be able to see certain more risk factors that can guide us as to whether these are associated with childhood cancer or not.
How do you prepare a child for a life with cancer?
That's a very good question, because children, you have to go through them through their parents. And as parents, you notice, and it's very well intended, that they want to protect their children and they want to hide the diagnosis. But I say you cannot do it for too long. So what we do first is actually to gain the confidence of the parents. And then with that, we either have ourselves or the parents in our presence, then disclose to the child that there is something wrong with them. And people will say, can you tell a 2-year-old they have cancer? They might not even understand.
No.
These children are different developmental stages, and you can speak to them in different. The level of detail might be different.
Depending on age.
But they need to know, because they also want to be in charge. Then you can imagine this adult who gets married and never knows that they had cancer as a child. That is completely not good.
Absolutely.
Yes, and the fact that once you've been treated for cancer, you really need to be followed up. And I was sharing with her and saying, Mom, you also need to be followed up. Yes, we treated you, we did a very good job.
But we need to follow up.
But we need to follow you up and make sure you're fine.
All right. Doctor, let's hold the thought. We take a short break and then we continue our conversation when we come back. In our episode today, we are privileged to have Dr. Karemi, who's a pediatrician and an oncologist. We are talking about childhood cancers. I hope you've learned something so far. We are going to take a short break. We'll be back right after this. Welcome back to this episode of Today's Parent, where we are talking about childhood cancers. Thank you for all the questions you're sending us so far on our SMS number 22999, and we'll start with one from Peter. Dr. Peter's question is, what's the difference between sickle cell and leukemia?
Actually, the difference is like almost night and day. Leukemia is cancer. Sickle cell is a blood disease. So sickle cell, there's a problem with your blood, so that the red blood cells which carry oxygen, they change their shape when they don't have enough oxygen, and they become like a sickle.
Okay.
So that's a totally different disease.
And I know we covered it in another episode, so probably anybody who has a question, they can go onto YouTube and see if they can find that episode on sickle cell. And then leukemia is?
So leukemia actually is a cancer of the white blood cells. Yes. And the white blood cells are the cells in the blood that fight infections.
I remember in biology. Loud and clear. We have a third question from Claire. Now, Claire's question is, they have a child who's been diagnosed with cancer, and she finds that it's really straining their marriage, and most of the time she gets the blame that this is her fault. I don't know, in your practice, if you find a lot of parents, couples coming in, just talking to you, though you're not a psychologist, that the effect that cancer has had on their relationship. Is this something you can touch on a bit?
Yes, I can, and I'll share, because I say cancer diagnosis and treatment is actually a very long and grueling and difficult experience for any family. It doesn't matter how, just having their child first diagnosed and then go through the treatment is, and the first things that happen is people will blame themselves, and parents will blame themselves and say, why does my child have cancer? Maybe my mom said I shouldn't marry this girl and that's the reason. Or some will be told, oh, you're cursed. Or it's because maybe you lost this job. So people initially go through a grieving period, and they're trying to explain why their child has cancer. And that's where us guys as healthcare providers need to be very cautious and need to bring out that message that there's nothing you've done wrong. There's no parent who would walk in and choose cancer for their child. So there's nothing they've done wrong. The other bit of your question was, what strain and what do we do for the stress that cancer brings to a family? Because as a couple, a lot will change. One might have to sacrifice their job. Sometimes they have to be separated from the family because they are taking treatment. They are away for long periods. There is the stress of finances that comes in, the stress of who brought this to the child. So a lot of things change. I have sort of a few restrictions. I would say, no, we don't want too many visitors at home. We don't want the child to go back to school. Sometimes we'll have to say one or two things have to be changed. You can't eat out in restaurants for a period of time. That completely changes the whole family.
The whole dynamic.
And sometimes we find some parents who have one child diagnosed and all they do is concentrate on that
this one child.
And they forget the other children. So us guys as healthcare providers, what we do is we work as a team. And I bring in my counselor, I bring in my psychology to the table, because I'm very good at giving drugs. I might not have the time to see what the family dynamics are, but once in a while, keep checking. How are you doing as a couple? Have you forgotten yourselves? Sometimes have one family member come in and take care of your child. Go out together, laugh, smile, take a walk. It's a whole breath of fresh air, so that when they come, they have enough energy for the child. Trying to show them, how do you work out their finances? It's expensive, but how can you work it out? How can we help you? Can we write a letter to your boss and say, please provide some? Can we allow them? A lot of employers actually, because of the absenteeism in work, they actually sacrifice some of these patients, some of these parents, and they lose their jobs. Remember, when you lose a job, they also have a financial stress are now coming about because they need to pay for their treatment. So having employers know, yes, they might not be physically present, but can you give them work that they can do either at the hospital or do at home that will keep them at least still in the system? And patient support groups. I cannot overemphasize that when a parent has been through an experience, they are the best people to counsel another parent and hold their hand. Show them there's a better day. That yes, you're crying now, but another day will come when you smile. And I was in your shoes, but I'm having a better day.
That's very important. And then for parents also to understand that going through that journey, not only with your oncologist, it's important for you to consider having a psychologist as well to work with you guys through this journey. Because you need that psychosocial support.
That psychosocial support is so important, and not only to the family, to the parents, even to the other children.
And even to the child.
And to the child himself. And a lot of the times we focus on the child, because I have the child with me all the time.
So speaking of which, Dr. Karemi, treatment options, you've talked about chemotherapy. So chemotherapy definitely, I think it's one of the options that most of us know about. So there's chemotherapy. How does a chemotherapy session look like when you're working on a child?
So chemotherapy is planned, and most of the times it's planned in a way we call a roadmap, because we are using several different types of drugs. And so when a parent comes in, for every session we tell you what to expect. And it initially starts with that we are going to give these drugs to your child, and this is what to expect. They might have a bit of nausea, they might have a bit of vomiting. Yes, they will lose their hair. These are some of them that are reversible, some will not be reversible, and I need to follow you up for a while, but just telling them what to expect.
Okay.
Then making sure that what you can take care of, like nausea,
you can
symptom,
take care of
very
that.
easy to take care of. The tastes in food, parents will have to say, you might not cook with this, but you can cook with this, that makes it better. And then the next is really now the session itself, where you do the planning and you give the drugs, the doses.
So how is it given? Intravenously, or is it you go under machine? How does it work?
So chemotherapy has various forms. There's what we give through an injection. There's what we actually swallow. And there's also what we can even give through the skin. And some we give through the muscle, or some we actually give at the back, where we call the backbone. And we just go through a small space and we give it to the brain, so that we can get the maximum doses getting to the brain. So it has different forms of administration.
I'm just wondering, Dr. Karemi, how do you make this experience for a child? I know, of course, seeing a doctor, the needles and all that, it's not something that any parent, even immunization is something we struggle with. So for a chemotherapy session, how do you make it for a child in such a way that it's not traumatic and, painful, and every time they see your door, they're screaming and shouting? How do you make it manageable for a child?
For a child. So a lot of times we tend to ignore and feel that children don't have an opinion. But that is very wrong. So once the parents are taken care of, they know. We also have to come to the level of the child and be able to experience. And there's something we call child life services. And what they do, they even use small dolls that they come to the child with and say, look at, this is a doll. Imagine this was actually you're the doctor and they're the patient. And they're like, oh, this is what they're going to go through. And sort of it reduces the anxiety. Yes, because you notice your injection might probably just be a small prick. But the anxiety around it can actually give a child nightmares, even before the day before.
That's very true.
So just taking care of that anxiety and then giving them that control, that yes, you have control to say, it's okay, can I take a jab now? Can I apply some medicine? Then make the experience as less painful as you can. For example, there are special types of lines that we use, that you don't have to keep looking for a vein, so that you don't have to prick this child 20 times.
That's even more traumatizing.
Exactly. So you just go in once and you're in the vein, and that makes a whole lot of experience for that child.
Wow. Your work is not easy, Daktari.
Yes, but it is so important and so fulfilling to actually give hope. Because that's what is lost with cancer, is that people lose hope. But to have that big message go out there that childhood cancer is curable.
It doesn't have to be a death sentence.
Detect it early. Know what symptoms to check out for, so that you can go. And I work at the Gertrude's Children's Hospital, and this has been one of our passionate appeals, that we want to raise awareness about childhood cancer. We want to change the story of childhood cancer. And that's why every year now, from 2017, we've been organizing a childhood cancer walk, where we are inviting families, we're inviting the nation as a whole to come out,
cancer walk,
so that we raise awareness. The more of you that come, we have specialists who will talk to you, tell you what are the key signs to watch for. Then just having that solidarity, walking and seeing other patients who've even been through the experience and are now living, creates a message of hope. So I really want to invite all of you to join us in June 28th.
Also, you're doing this one for this year, you're doing it in June.
June 28th.
Which is a Sunday.
It's a Sunday.
It's a Sunday.
So it's a family walk. I know it will be 10 kilometers, 5 kilometers, but it's fun. And we have
lots of important cause,
a very important cause at the University of Nairobi grounds. June 28th.
Okay.
Let's see you all there.
Let's
walk for our children. They deserve a chance at life, and we can do this.
You know what I like that you've emphasized on today is that our children deserve a chance to live. You know, whether or not they have childhood cancer, they deserve that chance to live.
Yes.
And you have emphasized that early detection is important.
Yes. Early detection, early diagnosis saves lives.
And can be 100% reversed.
Yes.
Most of the childhood cancers.
We can cure them. We won't say we can cure 100%. For some cancers now in the world, it's up to 98%. Actually, the disease they cannot cure now is probably relapsed disease. But for most first-time diagnosis, they can actually cure
98%,
them.
most of us parents can. That's wonderful.
That's a very good chance. But on average, 80% is curable.
80% is good.
It's curable.
80% of childhood cancers
is curable.
We didn't know that. Yes. That's good to know.
Yes.
Dr. Karemi, your final word of encouragement to a parent who's watching right now, nursing a child with cancer.
Yes. What I want to do is, for the parents and families with a child with cancer, is to tell them that they are champions, and they are champions of hope. And they shouldn't feel discouraged, shouldn't feel stigmatized. They should actually come out and share their story, because they are there, they are still surviving.
Right.
So, and there is no bigger message than when you see a child who had leukemia and now is an engineer.
There you go.
And he's a doctor, or he's a laboratory technician, or he's a news anchor. There is nothing as beautiful as that, because then a parent who is having their child diagnosed today is looking at you and saying, that's the champion of hope.
There you go.
I can be a soccer star. I can be a ballet dancer. I can be a laboratory. I can be a doctor.
Beautiful.
Yes, and it can happen. So it really, really helps, and it saves. This country should really look forward to treating children with cancer and curing them.
There you go.
Yes.
Dr. Ari, I think it would be unfair to let you go without connecting you to the parents who are watching. Yes. How can they get in touch with you?
All right. So I practice at Gertrude's Children's Hospital. As you rightly heard, my name is Dr. Doreen Karemi. I will have my email and my phone number shared with you.
Thank you.
And if they do have any questions, if they have any symptoms that they suspect could be cancer, please feel free to reach out to us. We are very happy to help you. Don't sit with your child. Keep insisting, doctor, there's something I heard about this. Check my child out. You might save your child.
Thank you, Dr. Karemi. Thank you so much for your time and the insights you have shared.
Yes, thank you for giving us an opportunity to raise a message of hope.
It was a pleasure.
Yes, thank you.
And on that note, we come to the end of today's episode of Today's Parent, where we had the pleasure of hosting Dr. Doreen Karemi, who shared insights on childhood cancer. She's left us with a message of hope. It's not the end of the world if your child gets diagnosed with cancer. Early detection, early treatment can save your child's life. Please make sure if there's in any way you want us to connect you to Dr. Karemi, send us an SMS on 22999 and we'll be happy to connect you to the good doctor. I have been your host, Christine Casina, and this has been Today's Parent here in studio at Little Cribs, where you come to when you're looking for exciting, durable, functional, and beautiful kids furniture. For parenting resources, don't walk alone. Go to www.supermamas.co.ke. As I always say, it's a good day to have a good day. So make a decision to have a good day. See you next time.